Ugandan scientists are keeping an eye on a rare mosquito species. Unlike the non-traditional malaria parasites which can be killed using indoor residue spraying and sleeping under mosquito nets, the new mosquito is said to be resistant to these prevention methods and yet more invasive.
This vector is more efficient in doing its work of transmitting malaria from one individual to another one, and also this vector is resistant to the current tools we are using. When there is resistance to a chemical that we use in our tools, it means it is going to delay the rate at which we can knock it out.
The Anopheles Stephensi is said to be spreading southwards and has so far been detected in northern Kenya. The new mosquito species has not been sighted in Uganda as yet, but scientists are worried it could cause a threat to the fight against malaria. It's known to breed mostly in urban areas in potentially open water sources, contaminated areas, and waste disposal sites. Even though cases of malaria in Uganda are higher in rural areas, scientists believe the parasite thrives best in urban settings.
We kill the mosquitoes at the time of laying the eggs and hatching, which is called larval source management. We either take away the breeding sites, but we know in towns and cities people collect waters in water tanks, in small troughs. There's a little more rubbish which collects water. And this mosquito can successfully breed and lay its eggs even in small amounts of dirty water.
Malaria still remains the leading cause of death in children under 5 in Africa. And globally, Uganda is one of the countries with the highest cases of malaria. With every 1,000 people, at least 480 are infected. The Ministry of Health says cases have been surging since 2022, with 300,000 cases reported almost every week. Scientists believe the malaria parasite is taking longer to clear in patients, which poses a risk to transmission.
Treatment failure is driven also by other things: dosing, compliance, if it is artemether-lumefantrine, taking it properly with a fatty food. So the manner in which the community and patients use the medicine also affects the outcome.
Campaigns to slash down bushes and get rid of dirty water sources and rubbish heaps have been ongoing to cut off any chances of breeding for the new parasite. Isabel Nakiria, CGTN, Kampala, Uganda.